Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center, and we're going to be talking about stress and how it affects pain. Now, if you watch the football games over the weekend, if you're in Arizona, I'm sure you had a lot of stress. I'm stressed right now. Every time I try to put one of these programs together, I'm stressed. I want to make sure that I get all this information out to you in a proper fashion. Research valid, everything up to date, everything that I can do to make sure that what you're getting is really 100% information that you can use and understand. Hi, Dinah King. Hello, how are you? And all the other people that are joining us. So anyway, I thought I'd mention to you that stress is not uncommon, believe me, okay? Sometimes it's some things that you're forced to, you have to do, that you don't want to do. But remember these letters, PACAP. This is very, very important involving stress. It stands for pituitary adenylate cyclase activating polypeptides. Why is that important? Well, that PACAP research has found is something found in your brain. From the brain, it goes to the amygdala, and the amygdala controls your stress, anxiety, and so forth. And if they can control this PACAP, this neurotransmitter that is released, you know what that means? It can actually reduce pain to probably almost all of it 100% gone, or very, very close to it. What that means for you is that a lot of those medications and pain medications, so forth, that you're taking, you don't have to take. So what they're doing is they're studying to find out how they can control this PACAP, which actually is a stress motivator that actually leads to pain. How do you like that? So no more opioids, no more drugs and medications that you're taking have all those other side effects and so forth. So research has shown that stress reduces your body's ability to manage pain. The higher the stress, the higher the pain. That's a fact. All this is research, okay? Stress has an interesting definition. It involves uncontrollability and unpredictability. For example, stuck in traffic, or maybe stuck in line at a bank and you're in a hurry. Or maybe how about those family problems, okay, with the children or with the spouse, or all the other things, the bills that come in unexpectedly, a leak in the bathroom. Oh my goodness, goes on and on and on. Well, there's positive stress and there's also negative stress. The positive stress, actually, like what I'm doing, okay? I'm stressed out when patients come in because I want to make sure I do everything I possibly can to help them, to make sure I get them back to as close to normal as possible, what they were prior to all of the pains and aches and so forth that they have. And so we try to do everything we possibly can for them. Matter of fact, I even call a lot of patients at night to follow up, to make sure that they know they're not alone, whether it be fibromyalgia patients or other patients involving their health problems and concern. That's my stress. I get my highs, I've said from the beginning, from seeing patients get back to normal. But in the meantime, I'm stressed to make sure that I do everything I possibly can. I try to run through my mind, okay, what did I miss? Is there something that I can maybe help these people with? Now, so now you know you have stress regardless. Some positive, some negative. Chronic stress is the killer. Chronic stress is the one that's a lot worse than acute stress. Okay, so you lost your wallet. Oh my goodness, I got to go and run, try to find out where it's at, and so forth and so on. And so for maybe an hour or two, a half a day, oh, thank goodness I left it. I couldn't believe it. It fell in between the car seats. Thank goodness. Okay, wow. I'm very, very happy about that. Thank the good Lord, pass the ammunition, all this, and you feel a lot better. So that's acute stress. But that chronic, day after day pain and anguish and so forth, those aches and pains and so forth, that's the problem. There's another problem that's caused by stress, which involves pain, that chronic, and that is, and I've mentioned this before in another talk, the longer you have chronic pain, it actually involves the gray matter in your brain. You can lose as much as 2 to 5% of gray brain matter per year under chronic pain, believe it or not. And obviously that can adversely affect you with your long-term plans as far as memory and everything is concerned. That's what gray matter is so involved with. Do you know, research shows that 66% of problems that enter a doctor's office are actually stress-induced. That was new research that just came out recently. So stress is a very, very important problem. How do you control stress? Well, you have to understand how it affects you, okay? When you get stressed, immediately adrenaline and cortisol is released out of your system. And you can have some of these different symptoms. Your increased heart rate, breathing gets faster, muscle tightening, okay? Oh, up in the shoulders and the neck, blood pressure goes up, so forth and so on. What are those? Some of those are those things that adversely affect you. You have to know what they are. You know, stress affects all aspects of our life: emotional, thinking, behavior, health, GI, digestion of food, depression, muscle tension, and spasms, and of course insomnia. So you have to recognize the symptoms that you're having from these problems so that you can control them. And I'll give you a few ideas as I go along in relation to what I do that might help you. Fibromyalgia patients, you have your own stress. Your stress, obviously, is, and I'm going to say this, your stress is actually caused by allopathic doctors, MDs, DOs, those doctors that really don't have a grasp or handle on what fibromyalgia is. And so that is an adverse effect that they don't believe you, okay? They call it psychosomatic, emotional, psychological, mental, all those things wrapped up into a term called psychosomatic. And so you become a stigma. The stigma is it's all in your head, or it's not real. Your pain isn't really real, But I'll give you another answer for it. Here's what it is. But the pain, if you're a fibromyalgia patient, you know yourself is real. Those pains and those symptoms, whatever it might be, muscle aches and pains, or intestinal, or rashes and headaches and so forth and so on, are real. Okay? Here's the problem with allopathic doctors, and I've mentioned this before also. Allopathic doctors are trained in their medical information and their training to diagnose patients by way of objective tests. Not what you tell them, but objective tests. What I'm saying is those blood chems and urinalysis and CBCs and MRIs and X-rays and all those tests that they run you through, for fibromyalgia patients, the vast majority of those come back negative. And those that are positive are actually for secondary conditions. And I've already talked about that. Every fibro patient has a secondary condition or conditions, okay? And fibro makes them all worse. So that's why you have maybe 15 different diagnoses that actually mimic fibromyalgia. But the allopaths, instead of listening to research, actual research versus just their training, has extreme difficult time in wrapping their hands around fibromyalgia and understanding what you're going through. So your stress, separate from fibromyalgia, are allopathic doctors not believing you. I've had so many come in, literally break down in tears, because I will explain to them, understand what they're saying, and I'll talk to them in terms of their condition and so forth. After 33 years almost working with fibromyalgia patients, I've seen almost everything come in. And they break down in tears and saying, you're the first doctor that actually I was able to sit down with and understand really what I'm going through. Well, I can't understand everything because every fibromyalgia patient is different. But my goodness, it is a very, very painful and very, very stressful condition. And what we do with our clinic is we work to make sure we do everything we can to help alleviate many of the symptoms and problems patients have. Hey, if you don't believe me, look at the Fibromyalgia Wellness Center website and look at the patients that have gone through our protocol and are doing exceptionally well. Now, stress and pain are a vicious circle. You start out with stress, and as a doctor, what happens, especially a chiropractor, the stress, the muscle tension, so forth, subluxations occur, pinched nerves, referred pain. It actually affects your liver function. You become depressed. Then you have an insomnia, more muscle tension and tendons and so forth tighten up, and then anxiety, shortness of breath. So what do? Most fibromyalgia patients, they take meds. Okay, I got to take this. This is for pain. This is for that, so forth and so on. But then, to make yourself feel better, you start doing things you shouldn't be doing. Maybe taking all those comfort foods, this will make me feel better. I'll eat this and so forth and so on that is inflammatory to your body. Okay? When that happens, insulin actually is released, and that affects your blood vessels. Blood vessels go through constriction and dilation, and then what happens is you have more severe pain. So, what do? Well, let's go back to that question I asked you. Do you remember when I said, remember back when you had that stress and how it affected you. You have to understand how it affects you. Everybody's affected a little bit differently. Could be faster heart rate, could be breathing heavier, could be a variety of different symptoms. What I do, because at the end of the day, many times, I'm so, believe it or not, I'm so worried, concerned that sometimes insomnia hits me, is I get in a dark room, I don't drink a lot of fluids before I go to sleep, and I really concentrate and thinking back on the last really positive things that happened in my life, whether it be a wonderful visit with the grandchildren, or that beautiful moments with a significant other, or helping that last patient, whatever it might. You have to pick out your de-stressing idea in inflammation. You have to know what the last real positive things were that really made you feel good. You have to sometimes really stretch back and think about it, because some of you have been in so much pain for so long, it's very, very difficult to dig things out like that. But you can do it. And just sit back and relax. You need a few moments time to yourself, okay? Not being bothered by anybody. I know children are around and the husband or wife is around, or this and that's going on. You got to erase that stuff out of your mind. Get yourself in a room, relax, sit back, tell everybody, I need 15. I need 15. Please, I'm going to close the door, and the world is going to be different after this. Boom. And then sit back and relax and think of the next or the last positive thing, the next positive thing that might happen, the next phone call that you're expecting that you know is going to be a lot of fun or enjoyable, or maybe even that weekend trip that you're going to be going on, or whatever it might be. Everybody has their own positive moments. Think the positive moments to reduce the stress. Also, if you know how to check your blood pressure or your pulse is right here, inside the wrist here, and just count off the number of beats in your wrist and see as it goes down as you start to relax. It's extremely important to understand that you can control some of this stress. And as soon as they find out how to control that PACAP, okay, that polypeptide neurotransmitter, fantastic, okay? Anyway, hey, listen, everybody have a wonderful week. Hey, next week, I'm going to be talking about carbohydrate confusion. Oh, my goodness. We got so many people asking about carbohydrates and all this ketone, different stuff coming out, diets and so forth. Extreme diets don't work. Extreme diets are usually harmful, I find. And it's very, very difficult for an individual to follow. People don't like diet. They don't like the word diet anyway, right? Okay, so you have to find something, and I think I found it because it really has helped me and a lot of patients, the fibromyalgia patients. I was having a little problem myself, and so I went on the same thing I told my patients, to do, and lo and behold, hey, guess what? It worked. I follow everything that I do, but we all cheat. We all have this problem as far as cheating and getting away from doing the right things, even doctors. And I want to make sure I always stay the healthiest I possibly can. Some of you are sending in questions and so forth. I'll get to them as fast as I can and get back in touch with you. Anyway, yep, time to go. It's about 15 minutes. Sometimes drag on a little bit longer. But I hope you understand about stress and how it can be really deadly for you, the chronic stress which causes pain, and how to help yourself a little bit. Many times it's not drugs and it's not comfort foods. It's actually getting away and relaxing and thinking a lot of positive mental attitude, positive things to get your blood pressure and your pulse down, and that way the rest of a lot of these other things can actually calm down also. Anyway, lots of love, blessings to all of you. Best wishes. Have a wonderful week. And next week, carbohydrate confusion. Boy, you're going to love this because there's some crazy stuff that's going on out there that I think would be really helpful, but also harmful for especially fibromyalgia patients or those patients that are having a lot of pain and inflammation. So I'll give you the good and the bad and the ugly and everything else in between next week. Thank you so very, very much. Have a great week. Be safe and enjoy. Bye-bye now.